Okay, hi. My name is Granna Jerry, and I want to read to you a story that I have about myself. The day I experienced a stroke, I immediately, in my brain, I just stopped smoking. Prior to having this experience, I had stopped taking what I call long-term medication. So when they came to offer me different meds, I held my hand up and said, "No, thank you." I had my stroke 5 years and 5 months ago on September 22nd, 2019. My original experience was very good. I mean, the nurses and doctors respected my wishes and freedoms as well as my person the way they should. Of course, I had to have medication when I was having the mechanical thrombectomy. Plus, I agreed that to take a baby aspirin daily for a while. I am unsure of the meds given when I first went into the hospital, for I was a Jane Doe who couldn't communicate anything. I did understand what people were saying, I just couldn't tell them. For example, when the ambulance crew was at my home, they were trying to find my purse and my identification. I knew right away, or I knew right where it was. It was on the chair pushed in under my dining room table. But I couldn't tell them, so I was unidentified to them. They came to my house because my son had called the ambulance from Kansas. After I called him, but couldn't talk to him. It's a miracle that I could even call him. I had first tried to call my son who lives down in Springfield, Missouri, but no answer. I was putting clothes away and working on tidying up the house when the stroke experience started. I can't recall exactly, but I was in my bedroom on my bed, and so was my dog Billy. Billy was trying to figure out what had happened. But I was on my bed trying to focus on my phone to make a call to get help. The right side of my body was limp or not able to move, so I couldn't stand up. I tried several times. I don't remember about my right arm, but I know it was affected, as was the right side of my face. I remember my son told me on the phone he's going to call for an ambulance to come. The ambulance crew got me ready, and they decided to take me to Mercy in Springfield. I was glad because I'd be nearer to my youngest son, who could help me get to my appointments at first. The point of my talking about both my past and my present health is to pass on the information, but also to help my fluency in articulation of speech. Most people tell me quickly that I don't have any problem, but this isn't so. I used to write proliferately, page after page after page. I always had some decline in my social speaking, but I often did well, and since experiencing the stroke, I had much trouble. So my working vocabulary is way less in my ability to speak and write. My putting out videos of me talking is going to require much more time reading, research, writing, and editing, as well as speaking. I've experienced loss of spontaneous speaking or voluntary speech. I will try to post at least every week, but I cannot promise because, as you will learn, it is very difficult. The MRI on my brain on September 24th 2019 explains the location of the stroke that I experienced. My diagnosis was cerebrovascular accident, unspecified mechanism, which means my brain had a stroke, but the cause is unclear. So many are the diagnoses that I've gotten. They're without a clear cause, but I'll get to that over time. They would know I had a stroke because of my symptoms, which included difficulty with speech or difficulty with language, difficulty moving some muscles, loss of balance, paralysis on my right side, darkened vision, difficulty swallowing, etc. The area of my brain with ischemia was in the deep brain. Findings on the MRI done the 24th of September 2019 was, in summary, large area of acute ischemia involving the left caudate nucleus, basal ganglia, and small scattered foci within the left frontal and posterior superior temporal convexity. The nurses told me the frontal lobe, the parietal lobe, and the basal ganglia were all affected. There are specifics to consider on each of these areas of the brain. The doctor did a mechanical and aspiration thrombectomy to the left internal carotid artery and the left middle cerebral artery. I was put under conscious sedation for 39 minutes during the procedure. On the angiography, there was revealed complete occlusion of the cervical left internal carotid artery. I had received intra-arterial verapamil for a catheter-associated spasm, which improved as a result. I also had an infarction of the left middle cerebral artery. A CT scan was done on January 3rd, 2020 as part of my request for a second opinion at Cox Health in comparison to Mercy Hospital. It worked out to do it this way, which I'll discuss also along the way. This scan showed my stroke now as an old and mature one, affecting the left basal ganglia and the left internal capsule. Interestingly, it also showed a normal aorta, as well as the same report of no stenosis on the right carotid artery. The stenosis in my left carotid was now at 70%, with a large ulceration measuring 9 millimeters length and 5 millimeters depth. No stenosis in the great vessels, the vertebral arteries, or intracranially. Before the experience of a stroke, I experienced a devastating automobile accident which left me with subsequent disabilities since April 20th, 2006. The combination of my whole life, my formal education in healthcare, my experiences in the healthcare system, etc., all add up to something of which I can state my intellectual as well as human opinions. I'd like to tell grand imaginative stories, but right now I'm not sure I can. It would take much recovery. Of course, before the auto accident aforementioned, I had much going on too, namely in my gut, which was the result of years, since I was a baby really, of stress and the inability to cope, though I didn't know that I wasn't coping. I worked overnight shifts so much of my life too because I had to for one reason or another. I'm the biological mother of 4 sons, and I managed to raise all of them until adolescence. But anyway, the point of my current look into my health and health care is that of the stroke, as well as my disabilities from the car accident and conditions that led to these things. You see, doctoring, from my viewpoint, cannot separate these things, for I am a whole person. I am not a separate. My whole person includes my life's goals beforehand and now. This includes my home of 25 years, which I'm so fortunate for all who helped me to stay in my home, and I'm so blessed that I have the attitude and aptitude as well as grit to survive on my own too. These are my experiences, strengths, and hopes, of which I'd like to share. I wasn't born with a silver spoon or anything like that. Every single thing is precious to me. I've had to manage on a lot less funds than I once did, and that is hard. And then when I was young, Mom didn't raise us. We were poor. We were very poor. But anyway, I had to manage on a lot less funds than I once did, and that is hard. I've had to manage with a lot less ability and help as I once did. But I've got my chickens still, cats outside, and dog inside with me. I've gardened and had outside chores, which some might laugh at, but without the call of them helping me to keep going, well, I wouldn't want to think about it. I've gone to several things in town, which is 12 to 15 miles, depends on where my destinations are. These involve my Bible study weekly, Tai Chi exercises weekly, swimming exercises here and there, going to the chiropractor monthly for my spinal decompression and adjustment, plus as needed, and massage therapy every 2 weeks for 1 to 1.5 hours. I manage the days so I'm just in town 1 to 2 times per week, but sometimes more if I have to adjust. But to save on the car, I generally go less. I also attend church about once a month since it's Sunday and all of my activities don't happen on Sunday. I try to take care of myself because that's what is best. I take full responsibility for all of my choices, good and bad. In general, I believe nobody likes to be a burden. Nobody ever promised me a rose garden or something like that. When I was in RN school, I won a small scholarship where I wrote I would be a part of saving waste and money in healthcare. I believe I've had a good start on that, which I'll share more of over the time. And I'm glad that Robert F.K. Jr. is doing something about the chronic diseases, and I think that my story would be a part of it. And there's a lot of doctors and people, nurses and stuff, who believe that we can do better than that we do now. So I thank you, and I hope you like that, and I'll try to get back to you again when I'm ready. Okay, bye.